The use of family planning methods for birth control has improved over the last 5 years. This is according to the Uganda Demographic Health Survey of 2016. Contraceptive prevalence rate in the country among married women generally increases with age and levels of education. This comes close to 50% of such women. Whereas big strides have been registered in family planning, the UDHS report shows that the rural areas still lag behind. 63.2% of all women in rural areas are not using any method of contraception as compared to 53% in urban areas. To contextualize this, members of the Parliamentary Health Committee and Reproductive Health Uganda visited 2 districts, Budaka and Chibuku, to establish how the communities there respond to family planning services. 43-year-old Rehema Muyama is a mother of 8 children. She visited Budaka Health Center 4 for the regular family planning sessions. Rehema says she would have given birth to 10 children had she not experienced 2 miscarriages. She says her husband has supported her to embrace family planning. Medical officers here told us they commonly attend to women between 13 to 40 years seeking family planning. They say the biggest percentage of those seeking their services are older women. However, the numbers of sexually active teenagers is also high.
The parents tell them, after all, for me, I've delivered 14 children without family planning. How comes even you can? You don't need it.
Whereas some of them respond to family planning, they face monumental challenges. Anna Teddy Nagudi and Christine Namusoke are 18 years of age and both have children. They are at the clinic to attend family planning services sessions, but the two have contrasting views on family planning.
I've ever heard about family planning, and I tried to talk about it with my mom, and my mother discouraged me to use any method of family planning. That they overbleed during their menstrual periods, and others say that the implants they use, some disappear in their bodies. She says she's now abstaining until she finds a fitting partner. Unlike Nagudi, Namusoke faced challenges when she used condoms as a contraceptive. Such side effects, coupled alongside primordial myths on family planning, has led to less dependence on contraceptives.
Anything which comes on their body, they say it is what? Family planning. Even if a mother has got a wound somewhere, we will come and say it is due to what? To family planning.
Namusoke says she tried to seek for more information on family planning but was not helped. Lack of information is a major challenge in accessing family planning, especially for teenagers in rural areas.
If the ministry and the Uganda government could allow us, we could start going where? To school, because these students are there and they are playing what? They are playing sex.
The number of adolescent girls in Uganda who get pregnant before attaining the age of consent has slightly increased to 25% in the last 7 years. This is due to low levels of education, as noted in the Uganda Demographic Health Survey. The medical officer in charge of Budaka Health Center 4 says other factors derailing family planning revolve around human resource and national medical stores.
It was on the 9th of August, where they only supplied one commodity in family planning. They supplied implants and we were only 6. And then the staffing is not enough.
However, the general manager at the National Medical Stores rejected this claim.
We would want to know how many did they order and then how many did we give them. Because if you say we ordered for 6 IUDs, or rather we gave you 6 IUDs, how many did you order for? Did you have more than 6 mothers who needed IUDs? They were saying that NMS was delivering to them a lot of pills, and the mothers were no longer preferring pills. They were preferring injectable, which was Depo-Provera.
Lawmakers will rely on their findings during the field trip to enrich debate during Uganda National Family Planning Conference later this month.
Our challenge is to see whether we are getting value for money, or we have problems with monopoly, or it is only underfunding. So we are assessing, and by the time we meet, we shall be in position to deal with the problem decisively.
Whereas the 2016 Uganda Demographic Health Survey report shows an improvement in access to family planning services, there is still a lacuna in extending the same services to sexually active teenagers. The government and the Ministry of Health have been stuck on how to introduce sex education in schools to curb the challenge of teenage pregnancies. Walter Mwesije, NTV, Chibuku District.